please welcome our next guest, Dr. Michael Stoiko, who's a pediatric intensivist at Novant Health, New Hanover Regional Medical Center. Thank you so much for coming today, Dr. Stoiko. I'm so excited to hear about the Children's Hospital in Wilmington. I know it's been there a while, but we're going to reinvent it, sort of.
Great.
So tell me a little bit about your background.
Well, I've been doing pediatric critical care now for a little over 37 years.
Really?
And between me and my two partners, Dr. Paulson and Dr. Pod, we've got about 80 years of experience.
Wow.
But I trained actually in pediatrics initially, and then did training in anesthesia and pediatric intensive care and neonatal intensive care.
Wow.
In Boston back in the 80s.
Yeah.
And came here about 10 years ago to help build the Children's Hospital here.
So you treat all those little tiny little babies that are born and end up in NICU, and
when they get bigger,
you take care.
if they're there, when they're that small, they're in the neonatal intensive care unit. Once they've left that unit, or if they get sick when they're older, up to age 18,
oh really?
we'll take care of them.
Oh, good to know. How did your upbringing and the history in the medical field, does that help you to connect with the children that you treat?
It does. To give credit to my mother was a second grade teacher, and was one of these people that just could not stop to talk to a child if she made eye contact with them. Was always loved children, loved babies, and I inherited that from her. So when I'm taking care of children, I connect with them, not as a physician, but just as another human being who happens to be the doctor taking care of them.
How sweet. How sweet. Yeah, I love when we see kids in the hospital. It's very endearing to me. I understand that you don't wear a white coat like most physicians. Is that the case?
That is true. I actually stopped wearing them in 1989.
Really?
Because I saw them as they're more, it used to be a symbol that you were clean. You weren't all covered in blood or something.
Right.
So you're coming in and look, you've got this nice shiny white coat on. But children don't recognize that meaning, and they don't recognize the purpose. They just see it as strange and different, and you don't look like a person to them. And it's scary for them.
It is kind of scary.
So I stopped wearing the coat and would come in, and they kind of look at you like, I'm not sure what you are, but I might give you a chance.
Kids are pretty smart. They know who they can trust, and that white coat is kind of scary, even for adults.
It is.
Yeah. So I really want to concentrate on the Children's Hospital. So tell me more about the hospital, and what would you like our community to know about it?
I would say most importantly is it is an amazing place. We've got physicians that are second to none. We've got now a number of subspecialists, and that number is growing both in depth and width. We've become associated now with UNC Children's, so the doctors are technically UNC Children's Wilmington.
Okay.
So I'm on the faculty, and all the other physicians are on the faculty at the University of North Carolina. We have a group of 3 peds intensivists and 6 inpatient hospitalists that take care of sick children. We have a large cadre of neonatal intensive care doctors and nurse practitioners. And the care that we give, I think, is really excellent. And it's very personalized, much more so than it is at a large academic type institution. And it's growing leaps and bounds. Just in the past few years, last year and a half or so, we've hired about another half a dozen subspecialists, and we're going to keep growing.
Now I know that when you're looking at the hospital, on the left you have the Betty Cameron Women's and Children's Institute, I believe it's called. So all of the pediatric services are encased in that building?
All of the inpatient services and some of the clinic. And then there's also out on the way to Wrightsville Beach.
Oh yeah.
There's the Nunnally Clinic out there.
Nunnally, yeah.
And it's a gorgeous building. It's a really, really lovely facility, and a lot of the pediatric subspecialists work out there and see patients there.
How many beds do you have in the Children's Hospital?
Well, we have technically about 25 inpatient beds.
Really?
For children. We have a 7-bed ICU. that is sometimes 8, sometimes 9, sometimes 14.
Whatever it takes.
We adjust depending on
Right.
the census. And the neonatal intensive care unit is technically 45, but at times we'll go up to 48 or 50.
I did not realize it was that large.
We're talking about almost 100 beds, yes.
Wow. I had no idea. And I bet you a lot of people in the community don't know that.
I suspect you're right. unless you've had the experience of
Yeah,
having
unless
somebody you love there, you don't really know what's going on most of the time.
So really, there's no need for patients to travel outside their communities here
Rarely.
to get this kind of care.
For example, we don't do pediatric heart surgery here.
Right.
But we do take care of children with heart disease. But
Right.
if they need surgery, then we would send them elsewhere for that surgery. If you need a bone marrow transplant,
Right.
for example, that's a very highly technical area that requires tremendous resources to support it, and that's not something that would make sense for us to have here at this time.
I know you're always trying to grow pediatrics services because the influx of people and the community is growing leaps and bounds. So I know you're always trying to grow those services. What are some of the things you think that, what are you doing now to enhance the care that you provide, and what do you see in the future?
Well, right now we just expanded up to our 3rd pediatric cardiologist, our 3rd pediatric gastroenterologist, GI doctor. We're looking to expand neurology. We've just hired a 2nd peds neurologist. We have a 3rd one that helps out, so we really have 3 now. And we were looking in other areas to maybe expand there too. And at some point we're going to have to expand inpatient services because we just keep getting busier and busier.
Yeah, and that's truth.
Yeah.
And we all see that. We see that here locally at this community hospital. There's never enough beds. And and it's quite a feat to get extra beds. It's hard to get those beds given the states, some of the state guidelines and what have you.
The certificate of need is challenging.
Yeah, it's very challenging. I hear it's probably going away in a couple of years given the Medicaid expansion.
That is the plan.
And speaking of Medicaid, do you see a lot of Medicaid patients? Is that part of, does that get covered in a...
Yes. All the kids in North Carolina are eligible to be on Medicaid if they don't have the family resources to pay for ACA care or whatever,
Right.
Obamacare. So most of the children that we care for, majority of them have Medicaid. And if they don't, when we first meet them, we try to get them signed up for it.
And you can help with that, help with that process of...
Yeah, we have social work and case management that will help us get those kids enrolled. So we rarely have we don't have children that are uninsured in that sense.
Right. And everybody gets treated the same.
Yeah. Oh yes.
It doesn't matter. Whoever walks through the door.
No, I now have grandchildren. I had 3 children. Now I have 2 grandchildren, and I can honestly say I attempt to, and all the people I work with attempt to take care of the person the way you'd want your child or grandchild taken care of.
Yeah.
And that's important.
It is very important. Do you have an emergency department just for children?
We are in the process of separating out an area specifically for that with people who will be trained just in pediatrics. And the plan for that, probably won't be fully developed for about 2 more years. But right now we've started that process of separating that out.
Okay. And that wouldn't just be for like critical care patients. That would be for bee stings and all sorts of things, right?
That's
that a
correct.
child may encounter.
Yeah, if a child has a more serious condition when they come in the door, they will actually call me or one of my partners, and we'll come down and work with the emergency room physician to help stabilize them and so on.
So that's what happens now. But in the future, you foresee a specific emergency department for...
Fellowship trained pediatric ER physicians.
That would be so great. You know, your kid falls down and hits their head and they have this big goose egg, and it would be great to have just a children's ER that you could walk into and receive that top-notch care. So
that has been our goal, and it is happening now.
So I want you to come back, but it sounds like there's all kinds of things on the horizon. I would love to have you back on the show so we can go through some of these things and just keep in touch about what's going on at that children's hospital.
I would love that. Thank you.
And I'm excited to go out in the community and talk about this now that I know more about it. It's great. So thank you so much for coming today. I would love for you to come back, and I'll get it on your calendar.
Thank you.
How's that?
It's
Thanks
been a
again for
pleasure.
being here.